Hi everyone, it's Derek here from AduMed. Welcome to today's case study on atrial fibrillation. Here we will aim to reinforce your learning by applying your knowledge in a practical sense through exploring a case. I've attached a link to our AF theory video, which contains a breakdown of all the information we cover in today's case study. Just before the end of each question, you can pause, write your answer down, and click continue when you're ready to move on. So let's dive straight in.
Bob is a 63-year-old male. He was recently discharged from hospital requiring treatment for new onset acute heart failure. This was found to be due to undiagnosed AF. In addition to his newly diagnosed heart failure and AF, he also has a past medical history of peripheral arterial disease, CKD with a creatinine clearance of 14, and asthma. So, our first question is, does he qualify for anticoagulation? Well, to answer this question, we can use the CHADVAS score. In this particular case, this patient scores 2 points as a result of his heart failure diagnosis, as well as his history of peripheral arterial disease. A score of 2 in a male means that he will benefit from anticoagulation. You can also use the new Orbit tool, which has replaced the old Hasbler scale, to determine his bleeding risk. So, on to our second question. As this patient qualifies for anticoagulation, what will be the first line treatment? Well, DOACs are usually first line, but in this particular case, they are contraindicated as the patient has a reduced creatinine clearance of less than 15. Therefore, warfarin will be more appropriate in this case. Question 3. So, what is a likely control strategy in this patient? Will it be rate control or rhythm control? Well, in this particular case, rhythm control will be preferred over rate control. As we discussed in our AF theory video, this patient meets the criteria for this as he has new onset AF, which directly resulted in him developing acute heart failure. He also falls in the young patient category under current NICE guidance as he is less than 65. Question 4. So what rhythm control drug is contraindicated in this patient due to its adverse respiratory effects? So some of our examples of rhythm control drugs include amiodarone, flecainide, propafenone, and sotalol. Sotalol is different from the other beta blockers due to it being used only for rhythm and not rate control. In view of this patient's asthma, we would want to avoid sotalol due to the side effect of bronchospasm. So, thanks for joining us today. Please share this with your colleagues if you found it helpful. Don't forget to like and subscribe, as this will really help this channel to grow.